We're going to be treating the fine lines of the lip. Pucker your lips for me. You can see these deep lines here. Now relax. She's not a smoker, but because maybe she puckers her lips a little when she talks, and she's got type 1 skin, blonde hair, blue eyes, she's started to develop these fine lines here. So there's a product named Restylane Refine that was specifically designed for these lines around the mouth. It's very elastic, so it moves as she moves. So we're going to not be treating the lip, but we're going to treat the skin of the lip. Here we go. You ready? Pinch. And what I like to do, because this has lidocaine in it, is sort of treat with a fanning technique sort of most of the skin of the upper lip here, just to start to get it a little numb. What's nice about this product, it is so thin that I can't even feel where I've injected. So that one of the issues with injecting these lips in this area was lumpiness, but with this product it's very difficult to not do a good job. So here I'm just fanning to try to get numbing in all those areas and to start the process. Now pucker your lips. Okay, relax now. Now what I'll do is, it's a little more uncomfortable treating these lines individually. So now that I've started to get it a little numb with my fanning technique, now I'm going to treat each line. And what's really nice about this injection is that this syringe goes and goes and goes. I can treat all the lines around the mouth, usually with one syringe. Okay, pucker for me. Okay, you're starting to see do that again, much improved. You have deep, deep lines here and much more superficial lines here. And this is going to last for about a year. I can even treat some of the fine lines here. It's a nice product to treat fine lines. But it's not going to give me any lip lift. It's only going to give me an improvement of fine lines. In a minute, we're going to go to Restylane Define, which we'll use to lift the corners of the mouth a little bit. Okay? Turn just a little bit. That's good. Okay. So here we are. We're going to inject now here again with this fanning technique. Starting to get some numbing going on here. She has used topical for about 40 minutes. Doing okay? Mm-hmm. Now so far I've used not even half a syringe yet. So this product really, really goes a long way. Now sometimes with other products, if we over-inject the upper lip, it gives sort of a chimpanzee look, making a fullness of the upper lip. Pucker your lips for me. You're just not going to see that with this product. It is so smooth. Sometimes patients say they feel a little beat up today because there's so many little injection sites, and by tomorrow, often I get phone calls the next day with people saying they can't believe how fabulous it looks. So it's really a fun product to use. Again, good, relax. So now I'm going to treat these fine lines here. This might hurt a little bit. Okay. Mm-hmm. Pucker again. Good, beautiful. Now, if I wanted to give her volume in the lips, I would not use this product. If I wanted to outline her lips, I would not use this product. I would use Restylane or Juvederm. But for these fine lines, this product is fabulous. Restylane Refine. Pucker again. Good. Relax. Pucker again. We can do the very same thing for the lower lip. She does not really have a lot of deep wrinkles in the lower lip. Pucker again. Good. Relax. Good. Now sometimes, now that it's numb, I'll do a little depot, just barely get the needle into the skin. And you'll see it, this works nicely with Bellatero too, that technique of just getting the needle barely in the skin and then injecting, and it sort of spreads out into the area where you want it. Pucker again. These lip lines are gone. Turn this way just a little bit. We're going to do this little depot technique again. Look how far the syringe is gone. I still have a little bit left. And I'm going to do the one that hurts the most. You ready? Mm-hmm. Okay. Pinch. This one hurts. Bear with me. It'll be just a second. I usually do the center of the lip last. You tolerated that pretty well, huh? Nothing like motivation. Okay. So this is the end of the refine. Nice and smooth. Now we're going to switch to Restylane Define, which is really nice for the oral commissures. So I like to do one vertical, to sort of start to get things numb. And then, as is described in the book, I inject in the form of an X. That brings the corner of the mouth up, and then we can also treat the marionette with this. So Define has a little more structure to it and can be used for elevation. Refine does not. Define I can feel slightly in there. Refine I can't feel at all. Doing okay? Mm-hmm. Okay, here we go. Same thing here. Use my fingers to pull the lip out laterally so that I can do my X nicely. This is Restylane Define with a D. I'm going to treat the marionette. Okay? Mm-hmm. Depot there to bring that up. We can also put a little Botox in the DAO, depressor anguli oris, to also lift a little bit. Sometimes people will feel a little fullness when you inject the corners of the mouth. Sometimes open your mouth for me. I'll have them put their finger in their mouth and just do a little compression when they're in the shower and their fingers are nice and warm, just to smooth that out a little bit. Treat the nasolabial folds a little bit with this. I would not treat this with Refine, but I did treat the fine lines with Refine. Define, because it has a little bit of elevation, was nice for softening here. Okay, that's 2 syringes. So we've used Refine to treat the fine lines, the smoker's lines around the mouth. We've used Define to treat the oral commissures. And you can see when she puckers that the fine lines around the mouth are much reduced. This will last about a year.